Hello, we will be talking about the professional guidelines for the use of social media. So we know that social media is already everywhere, and even in the healthcare industry, social media has already penetrated. And for that reason, we need to be reminded of the professional guidelines on the use of your social media. In terms of content credibility, as registered professionals, nurses, we should be able to share only information from credible sources. We do not share information from websites that could just be easily edited by others. We also do not share information from websites to which the information we have not verified. And then if there is any inaccurate information that we are encountered, we are actually obliged by ethics to correct this information. So for example, if somebody will be sending to you a wrong health information about COVID-19, you can right away reply that, ma'am, sir, that information is inaccurate based on the guidelines set by the DOH. Okay? Right there and then, you will be able to correct the individual if ever they have some misconceptions about a certain disease process or health program. Now, in terms of legal concerns, we need to be mindful and remember that the content of the author, the content we author or we made, may be discoverable. In other words, if I will be writing something in the social media, I will be responsible for it because I know that anyone can open it. Okay? Now, we comply with any laws that are existing and we also respect copyright laws. Then, in terms of licensing, we should know the professional licensure requirements for the state or even the country where we are belonging. So, for example, the practice of nursing is a privilege. Not everybody can practice nursing. So, for that, we need to understand that there are limitations and there is a certain scope of our practice that we can do. Okay? It's not because we are nurse we can already intervene in everything that is related to healthcare. Then, other than that, there are networking practices also. In the networking practices, we do not contact patients with request to join our network. Okay? So we do not just say, hey, you can join my network. Okay? If it's your personal network, no. Okay? So you direct your patients who want to join your personal network to a more secure means of communication or to your professional contact for that matter. So, for example, if a patient with diabetes would want to ask for your help and then send you a PM in Messenger, you have all the right and the responsibility to tell that patient, hey, you can go to this team. This is the team of patients with diabetes. This could be a support group that could possibly help you. Okay, we do not entertain queries on our personal spaces. Then in terms of patient care, we avoid providing specific medical advice to non-patients. Okay? For example, if somebody will be messaging you and asking you what to do with asthma, do not right away respond. The first place, are you sure that this patient has asthma? Okay? It takes diagnosis by the physician for that to be confirmed. And please understand that medical advice to non-patients may not be helpful. Okay? For example, if we're talking about antihypertensive drugs, not because amlodipine worked with a certain patient, it would work also with another patient. It needs to have assessment, it needs to have consultation with the physician before you can do your nursing intervention. Then we make appropriate disclosure and disclaimer regarding the accuracy, timeliness, and privacy. Now, during the time of the pandemic, telemedicine have been very common. But if you will go through the telemedicine, one thing that the doctor would be telling you, or the doctor's secretary will be telling you before you will go on the telemedicine is that they will appraise you. Okay? That a telemedicine consult is not ideal and that they will appraise you that assessment could be more accurate if done on a face-to-face setting. They will also appraise you that their assessment of you could only be as good as the information that you are telling them. In other words, the doctor are telling you the accuracy, the concerns on accuracy when it comes to the online consultation. And then if you are good with those limitations, okay, then you can proceed with the online consult. That's what we call appropriate disclosures. You tell them the possible advantages and then disadvantages of a certain modality that is being practiced. Then in terms of patient privacy, avoid writing about specific patients. No? You don't go social media and then say, I took care of a 60-year-old patient with colon cancer and then the family is black. Eh? You don't give random comments like that because you're too specific. You specified colon cancer, 60-year-old patient. Okay, there could only be one patient with that condition in your locality, especially in the hospital where you are working. So you need to be careful about the specifics that you are talking about your patients in the social media setting, or else you will have legal problems. Then comply with the laws, obtain consent if needed, then protect the patient information through de-information. In other words, for example, as a student, you're presenting case studies. When you are presenting case studies, you don't need to detail everything about the patient. You don't need to write Juan de la Cruz, date of birth is April 5, 2000, then the age, the sex, the address. You don't need to write all of those in your case studies. When we are presenting our case studies, we're supposed to present the pseudonym of the patient. If not the pseudonym, maybe the initials of the patient. Hmm? If you can notice, even in the hospital settings right now, on the doors, you could not anymore see the last name of the patients. It's to acknowledge the privacy of your patients. Okay? So much more in the social media context or setting. Then, for personal privacy, you need to use the most secure privacy settings available. Okay? It's not actually advisable to make your information public. It's not also advisable to make all of your posts public. You need to keep personal and professional profiles separate. Okay? That's why there are platforms such as LinkedIn that would allow you to have professional profiles. Then in terms of ethics, you need to disclose any in-kind or financial compensation received. For example, if I'm sharing a milk product in my Facebook page, and that milk product is being used, for example, in the market, and then they paid me to share it or to advertise it, I need to inform the public. Okay? I'm posting this because I'm one of the endorsers of company A milk product. Okay? That way, there is transparency. And then that way, the audience will be able to grasp whether they will be getting it from your own opinion or not. Okay? There should be appropriate disclosure for that. Then, in terms of licensing, you need to identify yourself on professional sites. Okay, you make sure. Okay, you make sure that your credentials are correctly stated. Then specify whether or not you are representing an employer for that matter. Okay, that allows you to properly represent the office where you are working if ever you are. Okay? Or you need to specify whether that is your personal point of view. That's why others, as you can notice, they would have the disclaimer that this video does not represent that of my company. Okay? That allows you to separate your legal entity or your legal entitlement from your company where you are working. Now, let's talk about Web 2.0, Web 2.0, then blogs or wikis. I hope you're familiar with this. You are all frequently using this in the internet. Now, there is a term Web 2.0 already now. And what is Web 2.0? In fact, we are already moving towards the Web 3.0. Now, in the Web 1.0, maybe the time that the internet first spread out, okay? So you have basic web pages, you have HTML, you have e-commerce, then you have the Java and JavaScript to formulate the web pages. Now, in Web 2.0, we are already in the social media, okay? Which is one key characteristic of Web 2.0. The websites are interactive. That's one keyword there that you need to remember. In Web 2.0, the websites are already interactive, especially social media. Contents are already generated by the users. There's mobile access. You have your phones, you can access the internet. You have high quality video and camera already. A lot of applications that gets to be updated. There's core monetizing of the data. There's high-speed communication, and then global internet access. Picked at 2006 to the present day. And even the present day right now, we are already moving into Web 3.0. What's in Web 3.0? What you can notice is that there is already the virtual reality and augmented reality, your VR and your AR, okay? Your metaverse. Then we also have your artificial intelligence. So artificial intelligence, for example, you ask a question and then a humanoid will be able to respond to your question, okay, without even the need of human assistance. So artificial intelligence is already coming its way. And when we talk about artificial intelligence, these are computers, these are machines that are learning on their own. Okay, they are learning on their own and can accommodate actually a wide variety of information, wide variety of data that allows them to analyze it at a split second and then share it to the public. Okay, so that's your Web 3. Your reference text would actually differentiate from Web 1.0 and then your Web 2.0. So Web 1.0 websites are not interactive, not based on content being posted or delivered by the users. So it's more of read, read, and read. They share news, you read, okay? You can't respond. But in Web 2.0, the websites are becoming interactive. Users can post, users can interact with one another, users can create their own content, can share their own content. You have your blogs, you have your wikis. So your wikis, just like for example, your Wikipedia as an example, or just for you to remember Wikipedia. So anybody can edit it as long as you will be able to specify. Okay? So it allows for the sharing of the content. Now, how did this impact your healthcare practice? It allows for care schedules. It allows for e-consultation. And then patient information on diagnostic tests is also being done. Okay? Now, among all of this, no, when we're talking about nursing informatics, when we're talking about the impact of technology in our healthcare system, still an important thing remains, and that is your effective communication. If you would look at effective communication, it is actually among the international patient safety goals. There are actually 6 of these goals, and the 6 goals would actually outline how can we be able to improve the care that is being delivered to our patients. And one is to improve effective communication. Okay? Now, there are organizations that advocate for effective communication. Among the best examples is your AHRQ, or the Agency for Healthcare Research and Quality. It is the same organization that formulated the team steps as in team strategies and tools to enhance performance and patient safety. Your team steps tells us that there are 4 primary trainable teamwork skills. These skills are leadership, followed by communication, mutual support, and situation monitoring. According to team steps, once we are able to train all of these 4 skills, the tendency is that teamwork will most likely be improved. Now, if a team would actually have the tools and strategies, it can actually leverage to build a fundamental level of competency in each of those skills that I have mentioned: leadership, communication, mutual support, and situation monitoring. And research has actually shown that the team can enhance 3 types of teamwork outcomes. And what are those teamwork outcomes? We are looking at the performance, the knowledge, and then the attitudes. Okay, those are the 3 important teamwork outcomes. From that, we have your essential communication techniques that we need to consider. So, for us to attain those outcomes and for us to improve the delivery of communication that we have for our clients, there are techniques that are recommended. One that you might have encountered in your basic nursing courses is what we refer to as your SBAR. ASBAR. So it is a technique of communicating critical information. Take note, one of its crucial usage is on the critical information that would require immediate attention and action concerning a patient's condition. Now, your SBAR is actually an acronym that would stand for situation, background, then you have assessment and recommendation. So for your situation, one thing that we tell on the situation is that what is going on with the patient. It should answer the question, what is going on with the patient? So if you're calling the doctor, S-bar is actually best used na. Picture yourself as a nurse that is referring to a doctor or a physician. There's a very good or there's a very practical situation wherein we can apply your S-bar. Let's say I'm the nurse communicating with my doctor. I will be telling the doctor, I am Nurse Gilbert on Ward 3, or let's say Medical Ward 3. I am calling about the condition of patient Juan de la Cruz. I am calling because she is having difficulty of breathing. I am concerned that she might have respiratory arrest. Background. Patient was admitted 3 days ago because of myocardial infarction. She had an operation, CABG, coronary artery bypass graft. Patient's condition has changed in the last 15 minutes. The last set of vital signs that I was able to take just now are the following: 36.5, 86 for the pulse. Then the BP is 90/60. The respirations is 35. The oxygen saturation is only 86. I think the problem is she's having difficulty of breathing, and other than that, impending respiratory arrest. I have already given or I have already started oxygen at 2 liters per minute. Okay, I am not sure what the problem is, but the patient may be deteriorating. I need you to come and see the patient. That would be your recommendation. Now, if you would look at the example from your reference text, which is actually shorter, you would notice that the situation answers to the question, what is going on with the patient? So when you call the doctor, you tell the doctor what's the situation, who is the patient. Don't just tell the doctor, I am calling for patient room 626. The doctor are not supposed to remember patients by room. As nurses, we are not supposed to remember them by room. So we mention the name first, followed by the room. Then we tell the doctor, we tell the healthcare provider what's the primary concern. Then background, give a concise background. What happened? Okay? For example, if your patient had chest pain, what was he doing 30 minutes ago? Was the patient walking around the corridor? Had the patient had difficulty of breathing? Had the patient had an argument, for example? And then assessment. What do you think the problem is? So in your assessment, you should be able, it is wise for you to already be able to collect the vital signs of your patient. And then, what are your recommendations? Right? Now, your S-bar is a reminder that we do not just call the doctors and then say, Doc, yung patient ko nahihirapan huminga. What would be the next thing? Tatanungin ka ng doctor, sino yung patient? Sasabihin mo, Doc, si Juan de la Cruz. Ano yung respiratory rate? Wait lang, Doc. Pupunta muna ako ng room. Kukunin ko yung respiratory rate. Pagpunta mo ng room, pagbalik mo, Doc, RR is 35. Sabihin ng doctor, ano yung oxygen saturation? Okay. Wait lang, Doc. Balik na naman ako sa room. Okay? It's annoying to have that kind of conversation. So whenever we are doing our assessment, we make it as concise as possible in such a way that we will be able to deliver it effectively to the physician, and that prompt care will already be given to our patients. Okay? That's why you have your S-bar, your situation, your background, your assessment, and then your recommendations. Now, another thing that we do is call out. Call out is a strategy used to communicate important or critical information. I would like to give the example here as a code. This is actually a picture that depicts an arrest situation wherein they need to defibrillate the patient. That picture is placed there because your call out is best practice during this time. And your call out is best practice during this time. Okay? Now, when we talk about call out, again, it's a strategy to communicate important or critical information. Why? It informs all the team members simultaneously during emergent situations. Your cardiac arrest, your code blue, is considered to be an emergent situation. Remember that we consider the condition to be cardiac arrest if our patient is pulseless. At the same time, our patient is breathless, pulseless, breathlessness. Okay? Or any acute sudden change in the condition of the patient, it warrants for the application of call-out, or any emergencies that we are addressing in the critical care settings. So it helps the team members to anticipate the next steps. And it is important to direct the responsibility to a specific individual carrying the task. Picture that you are dealing with a cardiac arrest. When you're dealing with a cardiac arrest, there could be 3 of you, there could be 5 of you. And each 5 of you should be doing something to give prompt attention to your clients. And that prompt attention could only be given if you have your call out. Okay? So, in such a way that, look at this example. The leader would say, usually it's the doctor would say, airway status. The resident answered, airway is clear. Then the doctor responded, breath sounds. The resident answered, breath sounds is decreased on the right. Then the leader said, blood pressure. The resident said, the BP is this, 90 over 60 as an example. So, right there and then, the doctor is asking short questions, and then the resident is asking or responding on short responses also. These short responses are vital. Okay? These are vital to assess the full condition of the patient. Without having to know this, okay, the entire team will be unable to determine and the entire team will be unable to intervene whether there is a problem on the part of your patient. Okay, or they will be unable to intervene correctly on the problem being encountered by your patient. And this communication is usually done in a well-modulated voice in the clinical setting. Okay? Hindi naman kayo nagsisigawan, pero dapat yung mga boses natin madaling mapakinggan. Hindi po pwedeng sinasabi yon through whisper. Okay? That's the purpose of your call out. Another thing that we constantly practice is also your check back. Okay? When we say check back, we use what we refer to as your closed loop communication to ensure that information is conveyed by the sender and that communication is understood by the receiver as intended. Nagpadala ako ng mensahe bilang sender. Ang purpose ng closed loop communication is para ma-check whether si receiver tama yung pagkaka-receive ng mensahe ko. Best illustrated on this diagram. So as you can see in this diagram, a communication occurs. Once this communication occurs, there is that closed, no, that closed loop there means the receiver accepts the messages, provides feedback and confirmation. And then the loop is done by the sender verifying that the message was received. Let's best for us to see an example. Look at this. If the doctor ordered give 25 milligrams of Benadryl IV push, the nurse's response is 25 milligrams IV push, doc. Again, 25 milligrams Benadryl IV push, doc. Then the doctor would say, that's correct. Okay? Meaning, from there and then, the nurse is able to countercheck what the doctor has said. They are able to administer the correct medication to the patient. Prompt care is given to the patient and correct care is actually administered to the patient. Okay? That's the purpose of your check back. Okay? Kung in other language, no, in other language, we actually read back. Okay, we actually read back to our doctors. Okay, before we confirm. Okay, or before we carry out the doctor's order. This is in particular situation when you are dealing with emergencies. Sa usual kasing situation, guys, no, kapag mag-rounds yung doctor or physician, they will make a doctor's order, then you carry it out. Okay, you will sign it out, you will carry it out. But in emergency situations, the doctors are actually doing the order while dealing with the emergency, or the doctors are actually giving the order while you are in the emergency without you having the paper to counter-check. So dapat, para ma-ensure yung safety ng pasyente, mag-check back ka sa doktor natin. Okay? You should be able to do check back to your physicians. Okay? Now, the next thing that we will touch on is what we refer to as your hands-off. Okay? Now, hands-off. Okay? Hands-off is very common. Anong tamang term dyan? It's like a nurse's day in the hospital, a nurse's day in any healthcare institution could not end without hands-off. Okay, without hands-off. Now, when you talk about hands-off, it's the transfer of information along with the authority and responsibility during the transition in care across the continuum. Okay? It includes an opportunity to ask questions, clarify, and confirm, okay, for your succeeding shift. It is actually a strategy designed to enhance information exchange during the transition in care. There's a more common word than hands off that is being used here in the locality, and that word is starts with letter E. That would be your endorsement. Yes, yes, that would be your endorsement. So you have your hands off or endorsement. So when I say endorsement, if I am the morning shift nurse, I could not go off duty without me doing the endorsement to the afternoon shift nurses or to the evening shift nurses. I need to transfer the information. I need to transfer the authority and responsibility to the incoming shift so that I will be able to get out of the hospital and then have my time off. So when we talk about hands off, your hands off are actually done during transitions of care. So shift changes is a very common time off, a hands off period. Then it could be a transfer of responsibility. Let's say transfer of responsibility from the nurse practitioner, okay, or the physician assistant, and even the physician, even the nurses, all the healthcare professionals are actually doing hands off. It allows actually for the continuity of care. Okay? Imagine you're a nurse. You cannot go on in the hospital having your duty for 24 hours. Okay? That would be impossible. There needs to be somebody to cover for you, and that is done or practiced during the hands off. Okay, or patient transfer. Let's say, for example, a patient would transfer from institution A going to institution B, so hands off needs to be done. Okay, there are different tools that are being used in hands off. The most common tool that we use is your cardex. Okay, cardex, remember in your fundamentals of nursing, your cardex is a summary of everything. It's the summary of your patient's chart. Okay, it's a summary of the patient care. In other institutions, Cardex is being referred to as nursing care plan 1, okay, or nursing care plan for that matter. Okay, others would refer to it as nursing plan, but basically they are of the same purpose. Other institutions use Cardex, but their Cardex is guided by the acronym I pass the baton. Okay? What's IPAS? IPAS is introduction. P is the details of your patient. A is assessment. S is situation. S is another safety. B is background. A is actions. T is timing. O is ownership. Then N is next. Okay? Now, what do I do in the introduction? When we are doing our endorsement, you try to observe in the hospital setting. When we are doing our endorsement, I will be introducing myself. Hey, I'm Gilbert. I'm the outgoing nurse. Okay? I will be endorsing first the patient in room 201. It's patient Juan de la Cruz. Okay? We mentioned the identifiers that are relevant to practice. 29, male, Roman Catholic, under the service of Dr. blah blah. Okay? Assessment. The patient had the chief complaint of the diagnosis is latest vital signs is. Right now, the patient is having breathing problems. The oxygen saturation were controlled during our shift. Then the laboratories came in. The hemoglobin is very low. I have already informed Dr. ABC. She has ordered for blood transfusion for the patient. The blood is already requested and is already available in the blood bank awaiting cross-matching. Now, for the background, you mentioned the comorbidities and the current medications. That's why if you notice, if the nurses are endorsing, we would usually, not usually, we always endorse all the medications that are taken by the patient. So for example, I would say the patient is taking azithromycin once a day that will be due by 12 noon. The patient is taking salbutamol every 8 hours that will be due by 4 p.m. and then by 2 p.m. Okay? For example, 4 p.m. and then 10 p.m. Now, you explain what actions were taken. Since earlier the patient had shortness of breathing, we need to make him stay on bed. Okay? And on the timing, you mentioned the level of urgency and prioritization of action. So for example, I mentioned about the blood. So you need to remind your incoming nurses that the blood needs to be administered in an hour. Okay? Or you should administer the blood ASAP once the cross-matching results are in. Okay? Then you need to identify if who will be responsible for these patients. What usually happens is that three nurses will be going out, okay, for off, and then three nurses will be coming in to replace the shift. So you should be able to identify if who will cover this group of patients, who will cover the next patients. And on the end, next, you need to mention what will happen next, okay, and what is the plan. So for example, you would mention that after the blood transfusion, the physician requested for another CBC to counter check its effect. Okay? You will appreciate more of this once you are looking into endorsement in patient care units. But as of this time, you need to remember the acronym I pass the baton so that you would recall the important things that you need to endorse or that you need to mention during the hands-off, okay, so that you will not forget those. Okay, that will be all for this lesson. Thank you very much for your kind attention.